Hey there, everyone. Welcome back to the Pillar Performance Podcast. This podcast, we sit down with leaders in their field of research, high performance, as well as the teams and the people and the founders behind some of the companies that are playing a really crucial role in helping Pillar particularly play a really crucial role in fulfilling our mission, which is to get athletes to the start line in the best possible condition. At Pillar, we specifically do that by developing micronutrition supplements across a range of need states, from recovery and sleep to inflammation, energy, and immunity. On this week's episode, the head of nutrition here at Pillar, Pip Taylor, has an opportunity to sit down with Elizabeth Inpyn to discuss the importance of omega-3 supplementation for endurance athletes. This is a really topical one for us as a company on the eve of us just releasing our Ultra Omega product into the US market. Which is really, really exciting. What we do know is throughout the episode, Pip and Elizabeth both cover the importance of omega-3 fatty acids of endurance athletes, obviously. They're also covering topics such as the different forms of omega and what does that mean for athletes, really breaking down the difference between EPA and DHA and the challenges faced particularly in this regard by plant-based athletes as well. They also discuss omega-3 indexing and how to potentially test for this if you've never done so before, and also the importance of testing and then being able to match that with optimal supplementation for what your body needs. The conversation then really highlights the impact of omega-3 on performance, on joint health, but also on overall well-being, and why this particular ingredient is really taking the performance nutrition industry by storm. And some really key takeaways in order for everyone to then go and prioritize health and nutrition, and including an out-of-the-box way to begin to supplement with omega-3. It's an amazing chat. Elizabeth comes with a wealth of knowledge, having had a very long history with omega use herself, but also particularly with her work and her company's work at Fuelin, which Elizabeth, as a sports nutrition coach for many professional endurance athletes, age groupers, and also teams, and plays a really crucial role in breaking down and decoding what nutrition is for these athletes. Elizabeth is also a former NCAA Division I distance swimmer, and a water polo player, multiple podium and at Olympic and 70.3 distance in triathlon, and is also a USAT qualifier for the Olympic distance in triathlon as well. She's also a certified sports nutritionist, comes with a master's in plant-based nutrition certification, and is an incredible wealth of knowledge in this regard. So it's an amazing chat. Looking forward to you guys to listen to this one. Remember as well that our partners at Fuelin are an amazing resource for any athlete looking to get on-the-ground nutrition coaching along the way of any training journey. So use the code PILLAR30 at checkout for the first 30% off your order, and I highly recommend checking out Elizabeth, Scott, John, and the team there at Fuelin in terms of trying to understand more about your fueling needs for your upcoming race or training block. Anyway, over to Pip and Elizabeth. Enjoy the episode.
Elizabeth, thanks so much for joining us. I'm really excited to have you on today, and we're going to be chatting all things omega-3 fats, and in particular benefits for endurance athletes. You're a dietitian yourself. I'm also a dietitian on different parts of the world. You're working with elite and professional athletes. You're a former athlete yourself. Do you want to give us a bit more of an introduction and rundown of your background?
Sure, absolutely. Pip, I have been a fan. I love listening to your podcast, so it's a pleasure to get to have time with you today, especially for Pillar, like some of my favorite products. So it's nice to be on. Yes,
good to hear.
I'm a sports performance nutritionist, so not a dietitian like yourself. I've been working with athletes, so it's a like Masters of Science in Sports Performance Nutrition. So I haven't ever done the clinical side of dietetics work, which I understand is a bit of work for sure. But yes, so I am currently with a company called Fuelin that I know that you guys are all very familiar with. So we are a performance training-based nutrition app. We sync with things like Training Peaks, Today's Plan, TriDot, Final Surge, all of those. And we prescribe fueling for the day, before, during, and after, based on an athlete's training schedule and kind of their race schedule. So it's been pretty revolutionary game changer for a lot of athletes to have their nutrition personalized and in their pocket. And it allows me to get opportunities like this to really work with athletes all over the world.
Fantastic. Let's jump straight in. Omega fats. I would say most people have heard of them, but without having any real idea of what they are, the different types, what are the potential benefits from both a health perspective as well as particularly for athletes.
Yeah. So I think when people hear omega-3s, a lot of the times they automatically think fish, seafood. They think a lot of people will mistake it for it's some kind of protein or it's some kind of vitamin or some kind of mineral, just because it's really prominent in health and nutrition circles. And I think a lot of times it's a really easy buzzword to drop, like, oh, get your omega-3s. But the full and kind of complete picture when you're talking about omega-3s, omegas are dietary fats. So these are important. They're either polyunsaturated or monounsaturated fats that are a very crucial and important component of a healthy diet. So we have omega-3s, 6s, and 9s. So we need all of these in our diet. The omega-6s and 9s are easier to get. They're more abundant. Unfortunately, some of the 6s are in some processed foods. And so that's where some of that concern lies in. But when you're looking at omega-3s, these are marine based. So I like to say that 6s and 9s are more plant based, and omega-3s are marine. So you can get those from fish, all different kinds of seafood, kelp, sea algae, those kinds of things as well.
And then within the omega-3s, there are different forms again. Do you want to explain those different forms and how they all have some crossover benefits, but also some particular and different benefits?
Yes, they are. So when we have the 3s, I always like to say, so like you have the 3s, we need them to build cell membranes to affect the function of the cell. They benefit like the receptors that we see in those membranes. They provide kind of a starting point, if you will, for making hormones, regulating blood clotting, and contraction for that matter, relaxation of the artery walls. They lower inflammation. So in general, omega-3s collectively are very important foundational pieces. And then when you break those down, then you have EPA and DHA. And that's where and then there's ALA and how our body breaks those down. But I think for the purposes of this podcast and kind of the general knowledge, we're talking and looking for EPA and DHA.
Yeah, that's a really good point, because I think the other one, and you mentioned it there as well, is ALA, and that's primarily from plant-based sources. And that's one that you would say, I mean, in your experience, again, people tend to get enough of that. They tend to meet that requirement, and the conversion rate of that into DHA and EPA is quite small.
Yes.
But it's the DHA and the EPA that we're really looking for when we're talking about cognitive function and support, cardiovascular health and support, and also, really important, particularly for athletes, is that muscle protein synthesis and injury recovery, repair, inflammation.
Exactly. So EPA, I call them kind of, imagine like the best professional teammates, if you will. It's like we need that, both EPA and DHA. EPA's main function is to reduce inflammation, and I call it like the calming, the lowering, lessening of inflammation. And then you have DHA, which a lot of people don't know makes up about 8% of your brain weight. So it is significant in the brain, and it contributes to brain development and function. So if you're looking like eyesight, cardiovascular function, for athletes, that's our reaction time, that's our mood, that's our alertness, that's all the cognitive processing. So we clearly need both of these components in order to be healthy individuals. So the team that works very well together, EPA and DHA.
Together. Yeah. And we might come back to this, but you just mentioned it really briefly, how important DHA is in the brain. And I know, we're focused on endurance athletes right here, right now, but how critical, and you might work with other athletes as well in the concussion space, and the abundance of research on being able to support through pre and post a brain injury, and just how critical that is. And I think it's one thing, again, I don't know about you, but anytime that you're putting together a nutrition supplement program for injuries of any sort, but concussion, omega-3 fats are the kind of the first one that I'm putting in there.
Always. And so I do have the privilege of working with some professional football players, soccer players, or football in other countries, both footballs, depending on how you look at it, that whilst they might not have concussions, they do have repeated head trauma. So without a doubt, creatine is in there. But omega-3s, I will not compromise on. And when I talk to athletes about the importance of not only preserving their brain, but also helping it post incident as well. And for triathletes, I don't know about you, but I have been riding a long time. I have been hit by a car. I did hit, it was a, good bike accident. Luckily I walked away, but a lot of triathletes, either you fall off your bike, your head hits the pavement, you're hit by a car, heaven forbid. It's omega-3s in protecting our brain in case that happens, but also in that recovery component of those kinds of incidences. It's important for all athletes. It's second for it was the word that we use, neuroprotective, right? To take care and protect your brain.
Yeah, really, really good point. One of the key questions that I get asked all the time: how do you know if you're having enough?
Well,
so what's your process when someone comes to see you and they say, okay, I know the benefits, you've told me the benefits, but how do I know I'm getting enough?
Yes. So I always like to lead with their daily diet and nutrition. I always want to make sure that whole real foods are the foundational building blocks. So I ease them in. Like, I can tell either they filled out an intake form, and I can tell, but I'll always soft ask, what is your consumption of seafood during the week? What kinds of omega-3s are you including? And then kind of based on their answer, they often realize in their own, as they're answering back to me, well, I think I had fish twice last month. So I start with the foundational diet component, and then I say, well, the good news is there's a very easy at-home test that you can take. It's called an omega-3 index. It's a simple finger prick. Here in the States, you can order it online. A lot of my international athletes, they have better healthcare than we do, and they don't have to pay for it themselves. Their primary care GP will order it for them. And it's a very simple test. Again, an easy finger prick. It takes results either within a few days or up to 2 weeks if you have to mail them back in. And it's a kind of percentage scale. And if you're looking at 0% to basically 12%, and it can go a little higher, but that 0 to 12 window. If you have 0 to 4%, we call that kind of the critically low range. And that puts you at almost an 80% greater risk of developing cardiovascular disease, of developing certain types of cancers, Alzheimer's. So that if you are in the 0 to 4%, you are in a very high risk, high likelihood of developing serious long-term chronic conditions. And then if you go from kind of 5 to 8%, that's you're better than most of the world, because here in the States, the average is about 3. I think where you are, it's like 4.8. So you're a little bit better off than us. But there's room for improvement. And then 8 to 12 is that ideal. You want to get your levels to 8 to 12%. So when I have athletes testing here, which before recommending any kind of supplementation, I always like to test first. And so I tell them, order 2 tests so that we can test now. And then when they get a product, an omega-3 product like Pillar, which is always my first recommendation because it's quality, then I have them retest and see how their levels have increased.
And what's the time frame for them to retest? Like, what are you seeing that time for it to shift that index?
So I like at a minimum 8 weeks. I like to do 12 weeks just because I find that there's a greater a greater jump, and athletes who see kind of a bigger leap up will be more likely to continue supplementing. So the two things that I see are inconsistency, and then they'll stop supplementing, like, oh, I got my levels up. Okay. But if I have them do it for a good 12 weeks, it's now become a part of their regular routine, and they're feeling better. The other component, when we were talking about brain health, and we should really get into them and kind of list specifically, but depression, anxiety, sleep is better, all these other things. And they've had enough time for all of those to really take effect. And then I know they're going to be more likely, like I will say, we've got your levels up here. We want to keep them here. So this is why we're going to continue supplementing, so that you keep feeling these. And at that point, it really is second nature to them. And so then I feel good about like that amount of changing a habit, if you will.
So you've raised a couple of things there, and I think it's, really key when you're looking at that testing. When you test that, as you said, the finger prick, it's a blood test.
Yes.
And so there's probably also a gap between testing and having that increased level in your blood index to it actually reflecting in your cardiac cells and your muscle cells and your brain cells, which is where we really want it. So as you say, it's important to continue on that path. And the other thing you touched on, and it just kind of makes me laugh, because compliance sounds like such a really strict word for it, but it's, because it's actually all about helping and benefiting people. So I don't like the word compliance, but we'll go with that for now because I don't have a better word.
I was going to say, please.
It's always an issue with athletes, as dedicated and hardworking and professional as they are, it can become a challenge. And I must admit, in the past, when I have been trying to get athletes to take omega-3 oils or fish oils, compliance has been a real struggle because of that fishy taste. So I don't know what feedback you're getting, but with the Pillar supplement, because it doesn't have any of that fishy aftertaste, I'm not having that problem with athletes anymore.
Exactly. And that's why it's the one that I will always recommend, especially to any of my plant-based athletes that I've convinced, like, okay, I'm not going to force you to consume any meat products, but I am strongly influencing your decision to take a EPA, DHA, seafood-based, omega-3 sub. And so I will always start them with Pillar because it doesn't have that fishy taste. And it's just anything that we can do as kind of nutrition leaders is to remove any barriers of entry, cost, taste, the needing of, I don't know if you've seen them, but some fish oil supplements, you have to have 6 or 12, and they might only recommend 6. But then when I look at the actual dosage that they're getting, I say, well, if you actually want a therapeutic dose, you're going to need 12 of these. That's why it's, a discount bargain price. So it's like removing anything that we can and giving them kind of the relief and confidence. Informed Sport Certified, batch tested, all of this info that they can get from Pillar and all that, it just makes it that much easier for them to jump on and stay on, if you will.
And as you say, a clinical therapeutic dose that is effective. Another really important point you mentioned there is that for plant-based athletes, because I know, both of us, we operate in food first. So diet and what you're having in the diet is really the first port of call. But when it comes to omega-3 fats for plant-based athletes, it's a real challenge. Can you talk me through some of your experiences there?
Yes, it is a challenge. And I always want to make sure that every athlete that I get the opportunity to work with feels supported and seen. And so I will never tell an athlete, well, we have to change, we need this. So it's like, how do I work within the confines of their either dietary restrictions or preferences? And so when you're looking at things dietarily, it's like, well, if it's not ethical, right? A lot of the times that's kind of the end all for them. And then they say, well, I'll get it from, there are plenty of companies that make plant-based And then I have to go through, well, I will support you using this, but this is how much you're going to have to take of this product if you want it to be converted. And then I will have them test and show them that at the cost that they're spending, and it's only increased maybe 1%, and we need to climb that ladder a bit. That's when it usually comes in that they'll say, okay, this product is quality sourced and I feel better about using it. And then I will, but I talk about things like hemp seeds and chlorella and spirulina and try to, I will bring in as many sources that I know, even if they're low in the conversion rate, like let's include as many of these as we can, but then we're also going to need to add a product on top of that.
Yeah, and that need to add in a product on top, are you seeing that's also applying to athletes that are happily consuming fish and regularly consuming fish? Are they, when you're testing them, are they still needing to top up? Because I know, I think we're still trying to gather evidence and any clear guidelines around amounts for athletes. But we know with level of athletic output and training that increases that muscle protein turnover, the inflammatory effects in the body. We'll say, obviously, we want inflammation to occur. So we're not trying to eliminate inflammation. We're trying to enhance the response to inflammation in a positive way. But are you seeing even athletes that do consume seafood regularly are still testing low?
So when Scott and I last year made a big push, I mean, people call me like the omega-3 queen for a reason, because I will tell anyone and everyone how important they are to their health, whether you're an athlete or not. And so last year we had Fuel and Athletes, we put like a challenge together and said, test now and then retest in a few, see where you're at, and then supplement. We saw where their levels are. We told them how much to take, and then we had them retest. And across the board, everyone's levels increased. I think the average starting point, and again, these are athletes that are mindful of their diet and mindful of consuming quality sources of different kinds of seafood. And so I think they hovered, or it was not quite 6%, or it was not quite 5%. And then everybody increased, we retested. And that's kind of the problem, right? The compliance issue of getting people to retest again. But of the, I think we had not quite 20 that we had more that started, but about 20. The increase was significant. And one of my athletes, he ate 3 servings a week of seafood. And I know they were good, solid, because I was working with him and I knew where he bought them. And he said, this is kind of the standard, like 3 servings of fish a week. I think that's better than the majority of Americans are getting. And his levels came in at not quite 7, so a little below 7%. And he said, how is that possible that, I eat seafood 3 times a week and I'm not even in the good level. I'm in the good, not the great. And we supplemented, and he ended up at 11.5% just in that 12-week jump. And he thought, okay, so you really can. And I'm not saying that's every case. I'm not saying that there are athletes that, some athletes may be eating seafood 5 and 6 times a week, 7 times a week, depending. But I would still always say test and then see where you're at. But even just regular consumption of seafood isn't always enough to be in that.
Yeah, and I think the other thing is that we're seeing even the sources that you typically say are really rich in those omega-3 fats, your salmon and your sardines and prawns or shrimp for you. I think what we're seeing, and I don't know enough about it, but have seen enough research on it, that with farming practices, those beneficial fats are actually falling as well. So even though you might think that you're consuming adequate and you're meeting the guidelines that are written out from the different countries' guidelines, you still might not be meeting even baseline levels.
Yeah. And to your point, we don't yet have the enough data. We have some, we don't have
Mm.
enough to show, is there a significant difference in athletes that sit at 8% on the omega-3 index and athletes that sit at 12%? And I believe that we will see and we will learn that athletes that are higher on that higher end will perform better, will recover better. So it's not just like we have higher demands. We know we have higher caloric demands. We know we have higher vitamin and mineral demands as athletes. So those averages for the general population, it doesn't mean that that's the most beneficial, especially for
Mm.
endurance athletes that are training
Mm.
15, 20 hours a week, repetitive sessions, that are doing all, multiple sports, strength training, I hope, all these different components and the demands on their body that they will need more than the average human.
So what are the what are the signs and symptoms that you might have, even without testing? Are the signs and symptoms that you might not be getting enough? And then are you seeing, when you're seeing those athletes retest and they are higher, is that being reflected in their training results? Can you see that in their, sleep recovery scores, or can you see that in what they're lifting at the gym or their reps on the bike or in the pool? Is there a a real tangible performance benefit that you can see?
I think I want to say, without putting athletes in a very scientific lab, it's hard to say that it's the one thing because there are so many other components in there that could be showing those potential benefits. But when athletes start paying attention to their omega-3s and when they are taking them consistently and when they are consuming a very whole food, the big one that I see are the sleep scores with their Oura Ring or Whoop or whatever, that quality, which then we know when your sleep is better,
Mm.
you are recovered better, you are performing better, you're thinking better, you're less depressed, you make better food choices. I mean, the list just goes on. So
Mm.
was that only the omega-3s, or was it the omega-3s that gave them better sleep? And then it was a combination of all of those things. I would say at this point, I don't care if it was the chicken or the egg. I just care that we have
Right.
this delicious omelet at the end, that they're feeling better and performing better. I think
Yep.
athletes, you see in terms of muscle strength, right? We have with my aging athletes, this I have seen. So they've done studies that show at kind of higher levels, they had to supplement with larger amount, but their muscle growth after strength training by incorporating omega-3s, they saw greater gains in strength, greater gains in recovery. So I know that, as we age and sarcopenia and it's harder to build muscle, that omega-3s help with that. Kind of the chronic inflammation and fatigue that a lot of athletes see, I've seen that get better. Improved VO2 max, right? That endurance capacity, because so omegas act as a vasodilator, getting more oxygen in your muscles. Sorry.
Sorry.
Omega-3s act as a vasodilator, getting more oxygen to your muscles. And so some athletes have seen that improved performance where VO2 max is concerned, and improved running economy. So they're just more efficient overall. What else? Greater range of motion in their strength training, reduced muscle soreness. So as they're going through all of these different components, we see as athletes collectively that they really are showing changes. And then when sleep is better and muscle recovery is better and they're getting more strength, they're performing better in their sessions, which then their coaches can prescribe stronger sessions or lift more weights. So yes, I have seen athletes that have improved because of that, for sure.
So when you are setting up a protocol for supplements, are there any specific timing or quantities that you're assigning to athletes, and is that based off their individual test results, their diet, how much they're training, but also what else their diet looks like? I
Yes.
know, broadly, as you said, we are dealing with athletes who are generally mindful of what they eat. But the other thing that I find with athletes as well is that there's still, yes, simply because of their large training output, there's quite a reliance on processed sports foods. They might be sports foods, but they're still processed. Does that factor into their need for omega-3 fats?
Yes. And I'm really glad that you brought that up, because as someone that competed in triathlon for years, sports products, as wonderful and necessary as they are not ideal whole health foods. And they are higher in processed ingredients, processed sugars. So very functional, especially for racing. And we want to practice anything we're going to race with in training. So we utilize that in training. But that does, if athletes are watching what they're consuming calorically, then if they're consuming calories in processed sports products, then they're subtracting a lot of the time, not that they should, but a lot of them will then subtract, say, 300 calories from somewhere else. And that's where that leads to trouble, because that they're not getting 300 calories from fruit and veg, or from, whole grains or seafood, or, any of those things. So yes, the diet that they consume, I will always look at that. I will look at what their goals are. If they're older athletes and they're saying, I'm exhausted all the time, my muscles are just tired, which is, I would call myself an older athlete. I feel that my muscles are just tired all the time. If they're trying to make strength gains, I take that into account. If they have a history of Alzheimer's or dementia in their family, or heart disease, I will look at that as a factor. So, which is really why I think it's important, and I know that you know this, that athletes just don't go grab supplements, first of all, because they're probably not going to get a quality one if they're just looking for price or convenience. But then if they don't have some kind of guidance as to what they want to be taking and how they want to make adjustments, how they fit it in, when they fit it in their day, they're taking 8 pills immediately after training, and it's like, oh, maybe we don't want to do that. Maybe we should, move and structure things a little differently. So it's a full, they have coaches to write their training plans for a reason, because it matters. When you put a swim first, or when you have a bike or a run, it matters what an athlete's goals are and how then they want to tailor using, because omega-3s are a tool, a very valuable tool to make them better athletes, to protect their heart, to protect their brain, improve sleep, and how they want to use that tool. That's where the changes are made.
And I think too, it's not a blanket approach, and it's not the one person throughout their lifetime, or even across a year, will also have changing needs. So as you say, the tool has to reflect those personal changes as well.
It's like one of those Swiss Army knives, right?
Right.
Omega-3s can do so many things. It can be a screwdriver, it can be a blade, it can be this. I should have thought this thing through, because I don't have a Swiss Army knife. Whatever any of the other tools are that are on that thing, it serves multiple functions. If and when my father listens to this, which he will laugh so hard at the thought that he will say, yes, that's exactly my daughter. She has no idea what's in a Swiss Army knife. All of these things at different points in time, you will need to change and adapt and utilize in the best way possible for your training.
And one other probably really important thing to mention too, which is again why the testing is important, why it's important to have support, is that there are probably some situations or health conditions or individuals where you may not want to be supplementing, or maybe want to be cautious about how much you're supplementing. Do you want to touch on any of those really briefly?
So I think because I was just working with a pregnant athlete, I think, and this is where I cannot stress enough, certification and informed sport and proper dosage really matters, not just for her, but for her baby as well. So those kinds of situations, if athletes are on certain prescription medications, if they're on antidepressants or blood thinners, that there can be complications there. If they're taking medicines for things like AFib, certain kidney and liver conditions that they want to watch out for. So if you have pre-existing medical conditions, you always want to talk with, at the very least, a dietitian or nutritionist, but your general practitioner or physician, to make sure that none of your supplements are going to be interacting negatively with the medications that you're taking. And that's where timing comes into. I know we briefly touched on that. When they want to take them, we know that, essential fats, they're absorbed best when taken with food. And so around a meal is always, a good time to make those. But I say setting up the habit of taking them is more important necessarily than taking them. So I say first make it a regular thing, and then worry about the timing specifically of when the ideal best time is. Like, let's good, better, best this. Good is getting it in. Better is dividing it up. Best is optimizing your window for when you're going to take it for those specific needs, right? If inflammation is something, then maybe 2 hours post-training session, that might be a higher dose for you. But some athletes say that they feel nauseous after hard training and they don't want fish oil, and that might not sit well on their stomach. So that's when you kind of have to be able to move it around.
I love that approach, actually. The first thing is getting it in, and timing is secondary. We've spoken about a little bit. We might come back actually to do a bit of cognitive function and health, and cardiac health, muscle protein synthesis. We haven't really spoken about joints though, and joint health, function, and inflammation. And I know that's that's kind of a key issue that crops up in lots of athletes, lots of endurance athletes, and particularly lots of older endurance athletes. It's a question mark. What's your take on joints and omega-3s?
So we know that omega-3 supplementation can help bones with calcium availability and calcium absorption. So that component of building stronger bones and joints. We also know that because it's anti-inflammatory and joints often get inflamed and tendons and ligaments can develop scar tissue, that's where that component, increased blood flow to the muscles, all of those things that end up giving us bone injuries, joint injuries, stiff, arthritis. There have been multiple studies in the benefits of omega-3s for arthritic conditions, for autoimmune conditions, which we know are super highly inflammatory. And so I think understanding as we age, things are going to get it's kind of like, for lack of a better word, it's a lubricant.
Yeah. Yep.
Gosh. To help ensure proper joint, ligament, tendon movement, but then also to really emphasize stronger, sturdier bones in the process as well.
Well, and I think it's important, we know that omega-3s are in every single cell structure and are part of that function and optimizing that function. So that's key. And as you said, you put it so well earlier, sometimes you don't really care if it's the chicken or the egg. If you're having a really great outcome, sometimes it doesn't really matter. And I'm certainly seeing that. I see that in athletes that have previously had joint pain and joint issues, and that it's hard to tell if that's the only change that they are making, but certainly from a dietary or supplementary perspective, it might be the only addition that they have made, and they are seeing positive benefits. Which you take, and any positive changes you take.
You do, because that positive change then leads to other positive changes. It's a domino effect. Like that momentum picks up. And I think creatine, yes, I think that really can play a substantial role in athletes feeling better and performing better. But other than that, there aren't a lot of supplements, if you will, that are so well-rounded in terms of their benefits, but also that athletes feel like. I've never heard an athlete say, "Yep, I can tell my calcium's better." Like maybe if they're not breaking a bone, but it's not that. It's very rarely do I hear, athletes like, "Wow, that multivitamin, if I go a day without my multivitamin, I'm just not the same." No. But many athletes will say when they consistently take omega-3s, these things feel better. And when these things feel better, then they are making better decisions about the dietary choices that they're making. Once they learn what good sleep feels like, then they become, sleep doctors, and they want more and they want better sleep. when they realize their joints don't hurt and they can actually get into a low squat, like low back squat in the gym, then they're going to start adding extra weight. And, it's just this beautiful kind of
Flow on
panacea.
effects.
Yes.
Yeah.
Yes. So I say, let's just like start with this. If you're not going to start with anything else, run, get some omega-3, start taking them. And, test first, because I'm a scientist and I think that's important, and data is always fun, and then they can see, but like grab some omega-3s, incorporate them consistently, and watch how much better you feel.
Fantastic. We might wrap it up there, Elizabeth. It's been super informative, really interesting, some really key messages in there. For me, it's certainly, when it comes to omega-3s, is very much a case of food first, but not food only. If you had one key message that you want to wrap up and give to endurance athletes, what would that be?
I would say prioritize your health above all else and everything that entails. And that entails consuming, like, it's so easy for athletes to focus on the performance and training side and kind of neglect the nutrition side. And you're never going to see the performance gains that you want or longevity in the sport that you want if you're not prioritizing nutrition. And omega-3s especially will help with life longevity and thriving for years, but it will also really help with sports performance. It is a win-win.
Amazing. Thank you so much.
Thank you. It's been a pleasure.